Hey everyone, and welcome to the Deep Dive. We're going to tackle something that's really important in the world of sports.
Mm-hmm.
Concussions.
Uh-huh.
We hear about them all the time, but I feel like there's still so much confusion around what they actually are.
Yeah, there's a lot of misinformation floating around.
Exactly, and a lot of athletes, especially at the younger levels, uh, don't really know what to look for or what to do if they suspect they might have one.
And the problem is a lot of concussions go unreported.
Oh, absolutely.
Hmm?
It's a huge problem.
Yeah.
Millions of people are affected by sports-related concussions every year. And you're right, a big chunk of those never even get reported.
It's scary to think about how many people are playing through these injuries without even realizing the potential risks.
So for this deep dive, we're going to really break it all down.
Yeah, we've got a ton of great information to share with you today.
We're going to be looking at the latest research, the consensus statement on concussion in sport, all sorts of interesting studies, and we're going to try to make sense of it all. So whether you're an athlete yourself, a coach, a parent, or even a medical professional who works with athletes.
This deep dive is for you.
Exactly. We're going to try to cover all the bases here.
We want to give you the knowledge you need to stay safe and make informed decisions.
Well, let's start with the basics. What exactly is a concussion? I feel like back in the day, it was just like, oh, you got your bell rung, you got knocked out, you had a concussion.
Right.
But it's a lot more than that.
Yeah, it's definitely evolved over the years. The understanding of concussions has changed dramatically, even from when I was playing.
Oh, I bet. So tell me more about how the definition has changed.
Well, the newest definition from the 6th International Conference on Concussion in Sport describes a concussion as a traumatic brain injury caused by these biomechanical forces.
Biomechanical forces. That sounds pretty intense.
It means a direct blow to the neck or even the body, as long as that force is transferred to the brain. And what happens is this force sets off a cascade of events inside the brain. It affects these neurotransmitters, disrupts the brain's metabolism, and even causes problems with blood flow and inflammation.
So it's not just a simple bump on the head like we used to think.
Not at all. It's way more complex than that.
So it's so complex, how do you even diagnose it?
That's where it gets tricky because unlike some other injuries, a concussion can't always be seen on standard imaging like a CT scan or an MRI.
So you can have a serious concussion, and the scans might not show anything.
Exactly, which is why it's so important to go beyond just those basic scans and use more comprehensive assessment tools.
Okay, so what are some of those tools that are being used now?
One of the most widely used tools is the SCAT, which stands for Sports Concussion Assessment Tool.
I've heard of that one.
Yeah, it's gone through a number of revisions over the years to keep up with the latest research, and the current version is the SCAT-6.
The SCAT-6, so it's pretty advanced now.
It is. It looks at a wide range of symptoms, everything from headaches and dizziness to things like confusion and memory problems.
So it's not just like how many fingers am I holding up kind of thing.
Not anymore. There's a lot more too. It involves a pretty thorough evaluation.
So what kind of things does the SCAT-6 actually involve?
Well, there's a series of questions about the athlete's symptoms, a physical exam to check things like balance and coordination, and a cognitive assessment that looks at things like memory and concentration.
Wow, that sounds really comprehensive.
It is, and it's really designed to give healthcare professionals a good overall picture of how the athlete is functioning after a potential head injury.
Okay, so that's the SCAT-6, but you mentioned there's also something called the SCAT-6, right?
Yes, that's correct.
So what's the difference between those two?
So the SCAT-6 is a more in-depth evaluation that's typically used in a clinical setting starting a few days after the injury.
Ah, I see. So it's like a follow-up evaluation.
Exactly. It digs a bit deeper into the athlete's medical history, their symptoms, and their neurological function.
So you're really gathering different types of information depending on the timing and the setting.
Exactly. It's all about getting a complete picture of the athlete's condition.
Okay, that makes sense. And it's really interesting to see how the approach to concussion diagnosis has become so much more sophisticated.
It's a constantly evolving field, and it's great to see that the focus is really shifting towards these more comprehensive assessments.
Now let's talk about the athlete's perspective, because I know from personal experience that sometimes athletes are hesitant to report concussions.
Oh, absolutely. It's a big concern.
I mean, I remember back when I was playing, there was always this pressure to be tough and to play through pain.
The tough it out mentality.
Yeah, exactly. And I think that mentality still exists today, especially in certain sports.
It does, and it can have serious consequences because ignoring a concussion can really put an athlete's health at risk.
Right. And we actually have some research here that suggests athletes often don't report concussions, and this is a big deal because, as we've learned, concussions can have long-term effects.
It's true, and there are many reasons why athletes might not come forward if they suspect a concussion.
Like, what are some of the main reasons?
Well, fear of being sidelined is a big one.
Yeah, I can imagine.
Athletes worry about losing their spot on the team, disappointing their coaches, and even jeopardizing their future in the sport.
It's almost like there's a stigma attached to reporting a concussion.
Unfortunately, there is. In some cases, it's seen as a sign of weakness or a lack of toughness.
Which is crazy because we know now that it's a serious injury.
Exactly. And it's important to shift that mindset and create a culture where athletes feel comfortable reporting their symptoms.
Absolutely, because their health is paramount.
Exactly. And just to give you an idea of how underreported concussions can be researched using this technology called virtual reality, VOMS.
VOMS.
Yeah, it stands for vestibular ocular motor screening. And it's showing that up to 50% of concussions might be going unreported.
Wow, that's a huge number.
It is, which is why it's crucial to create an environment where athletes feel supported and encouraged to speak up.
Okay, so how do we do that? How do we make athletes feel safe coming forward if they suspect they have a concussion?
Well, education is a huge part of it. Athletes, coaches, parents, everyone involved in sports needs to understand the potential risks of ignoring a concussion.
They need to know that it's not a sign of weakness to report a concussion. It's a sign of strength.
Exactly. It's about taking care of yourself and making sure you're healthy.
Right. It's about prioritizing long-term health over short-term gains.
Absolutely. And open communication is also essential.
Between the athletes and the coaches and the medical staff.
Athletes need to feel confident that they can report their symptoms without fear of repercussions.
That they'll be listened to and taken seriously.
Exactly, and that their health will be put first.
I think preseason baseline testing is also a really valuable tool in all of this, right?
It is. It can be a game changer.
So tell me more about how baseline testing works and why it's so important.
So baseline testing is basically like taking a snapshot of the athlete's normal function before the season starts.
Okay.
It involves things like balance assessments, cognitive tests, and those symptom checklists we talked about earlier.
So you're getting a baseline measurement of their balance, their cognitive abilities, and their overall health.
Exactly. And then if an athlete does sustain a head injury during the season, doctors can compare their post-injury performance to their baseline results.
So it's like having a reference point to see if there's been any decline.
Exactly. It makes it much easier to identify potential concussions, even if the symptoms are subtle.
Okay, that makes a lot of sense. And it seems like a really valuable tool for protecting athletes.
It is, and it's becoming increasingly common at all levels of sport, which is great to see.
So we've covered a lot of ground here already. We've talked about what a concussion is, how it's diagnosed, and the importance of athletes feeling comfortable reporting their symptoms.
Right. And we've also touched on the role of baseline testing in helping to identify potential concussions.
But we're just getting started, folks.
Yeah.
Stick with us, because in the next part of this deep dive, we're going to delve into the exciting world of concussion treatment and recovery.
We're going to talk about all the latest research and strategies for helping athletes get back to their best selves.
So don't go anywhere.
We'll be right back after the break. Welcome back to the deep dive.
All right, so we've talked about what a concussion is, how to diagnose it,
Right.
and how crucial it is for athletes to report their symptoms if they think they might have one.
Absolutely. That's key.
Now let's dive into what happens after a concussion is diagnosed.
Okay.
Because I know from personal experience that years ago, it was all about rest.
Oh, yeah.
Like dark room, no screens, no stimulation whatsoever.
The old school approach.
Exactly.
Yeah.
So is that still the go-to treatment, or has things changed?
Well, things have definitely evolved over time. Research has shown that complete rest might not always be the best approach.
Really? So no more hiding under the covers for weeks?
Not necessarily. The latest consensus statement actually recommends a more active approach to recovery.
Interesting. So what does that actually look like?
Well, rest is still important, especially in the initial stages, but it's not just about lying in a dark room anymore. The focus now is on gradually increasing physical activity as the athlete's symptoms allow.
So you're saying exercise can actually be beneficial for concussion recovery?
That's right. It might seem counterintuitive, but light aerobic exercise can actually help speed up the healing process.
Okay, I'm intrigued. Explain this to me.
So when you engage in light aerobic activity, it increases blood flow to the brain, which helps deliver oxygen and nutrients to those injured neurons.
So it's like giving your brain the fuel it needs to repair itself.
Exactly. And it can also help reduce fatigue and even boost mood, all of which are important for overall recovery.
Okay, that makes sense. But what kind of exercise are we talking about here?
It's not about intense workouts or anything like that. It's more about starting with gentle activities like walking or stationary cycling, and then gradually increasing the intensity and duration as tolerated.
So it's all about listening to your body and not pushing too hard too soon.
Exactly. And it's important to work closely with a healthcare professional who can monitor your symptoms and adjust your exercise plan as needed.
So it's a very individualized approach.
Absolutely. Every concussion is unique, and recovery time can vary depending on the severity of the injury, the athlete's individual characteristics, and a whole host of other factors.
Right, so there's no one-size-fits-all approach.
Definitely not. It's about finding what works best for each individual.
Now, besides exercise, are there any other therapies that can be helpful during concussion recovery?
Yeah, there are actually a number of different therapies that can address specific symptoms.
Oh, like what?
Well, for athletes who experience dizziness, balance problems, or visual disturbances, something called cervicovestibular rehabilitation can be really effective.
Cervicovestibular rehabilitation, that's a mouthful.
It's a type of therapy that focuses on the connection between the neck, the inner ear, and the brain.
Oh, interesting.
Yeah, it uses targeted exercises and manual techniques to help retrain those systems and alleviate those pesky symptoms.
So it's like hitting the reset button on those systems that got scrambled during the concussion.
Exactly. And it can be a game changer for athletes who are struggling with those types of symptoms.
Now let's talk about the long-term implications of concussions, because I know that's something a lot of athletes and parents are concerned about.
It's a valid concern, and it's something that researchers are still actively studying.
Because we've all heard stories about athletes experiencing problems years or even decades after multiple concussions.
Right. And while more research is needed, we do know that repeated concussions can increase the risk of long-term issues.
So what kind of long-term problems are we talking about here?
Well, some athletes might experience persistent headaches, difficulty concentrating, or memory problems.
Those are definitely not things you want to be dealing with long-term.
No, they're not. And in more severe cases, there can be changes in mood, personality, and even an increased risk of developing neurodegenerative diseases like CTE.
CTE. That's the one that's been in the news a lot lately, especially in contact sports.
Yeah, it's a serious condition, and it's definitely something we need to be aware of and continue to research.
But it's important to note that the research on CTE is still evolving, and there's still a lot we don't know about it.
That's right. But what we do know is that protecting athletes' brains is paramount, and that includes taking concussions seriously and following proper management guidelines.
Absolutely, because when it comes to brain injuries, prevention is key.
You got it.
Now, speaking of prevention, let's shift gears a bit and talk specifically about concussions in young athletes, because their brains are still developing, which makes them particularly vulnerable.
That's a crucial point. Young athletes are not just miniature adults. They need extra care and attention when it comes to concussions.
So what are some of the key considerations for managing concussions in this age group?
Well, first and foremost, recovery times tend to be longer for young athletes.
Oh, I bet.
Their brains are still developing, so they need more time to heal properly.
So it's even more important not to rush them back into play.
Absolutely. We need to be extremely cautious and prioritize their long-term health.
And it's not just about physical recovery either, right?
No, concussions can also affect a young athlete's schoolwork, their ability to concentrate, to learn.
Right, their brains are working overtime already, just trying to develop and grow.
Exactly. So it's crucial to have open communication between parents, teachers, and medical professionals to make sure the student is getting the support they need.
So accommodations might need to be made at school, like extra time for tests, reduced homework loads, that sort of thing.
Absolutely. It's all about creating a supportive environment that allows the student to recover fully.
Well, we also have some research here that looked at concussion rates in different youth sports, and this is something I think a lot of parents are curious about.
Definitely. It can be helpful information when making decisions about which sports to allow their kids to participate in.
So what did this research find?
Well, it found that certain sports like rugby, hockey, and American football tend to have higher concussion rates than others.
Which makes sense. Those are all high-impact collision sports.
Right, and sports like volleyball, baseball, and cheerleading had lower rates.
So it's not surprising that the sports with more contact and potential for collisions have higher concussion risks.
Exactly, but it's important to note that even within a specific sport, there are things we can do to minimize risk.
Like, what are some examples?
Well, proper technique is huge. Coaches play a big role in teaching athletes how to tackle, how to hit properly to reduce the risk of head injuries.
I bet.
And of course, appropriate safety equipment is essential.
Helmets, padding, all that good stuff.
Exactly. And creating a culture of safety within the sport is also really important.
What do you mean by that?
Well, it's about making sure athletes understand the risks of concussions, encouraging them to report symptoms, and really prioritizing safety over winning at all costs.
That's a really important point because sometimes the pressure to win can overshadow everything else.
It can, and it's up to the adults involved, coaches, parents, league officials, to set the right tone and make sure safety is always the top priority.
Now we've talked a lot about youth athletes, but let's not forget about para-athletes because they face unique challenges when it comes to concussions.
Absolutely. Their pre-existing conditions can really complicate both the assessment and management of concussions.
So what are some of the specific things that need to be considered when dealing with concussions in para-athletes?
Well, for starters, it can be tricky to distinguish concussion symptoms from symptoms related to their underlying condition.
Right, because they might already be experiencing things like dizziness or balance problems as part of their disability.
Exactly. So it's crucial to have a really good understanding of the athlete's baseline function and medical history.
So individualized assessments are key.
Absolutely. And the consensus statement actually emphasizes the need for modified testing and return to sport protocols for para-athletes.
So it's all about tailoring the approach to each individual's specific needs.
Exactly. We can't just use a one-size-fits-all approach.
Now, I know we're going to be talking about some cutting-edge technology in the next part of this deep dive, but are there any new developments specifically related to concussion management in para-athletes?
Well, there's a lot of research going on in this area, but one exciting development is the use of wearable sensors.
Oh, like those things that track your heart rate and steps.
Similar, but these sensors are specifically designed to detect impacts to the head.
Oh, wow. So they can alert medical staff if an athlete experiences a potentially concussive blow.
Exactly, which can be really helpful, especially in sports where athletes might not always be able to communicate their symptoms easily.
Right. That makes a lot of sense. And it's great to see that technology is being used to improve concussion management for all athletes.
It is, and it's just the beginning. I think we're going to see a lot more innovation in this area in the years to come.
All right, so we've covered a ton of ground in this part. We've talked about the shift towards a more active approach to concussion recovery,
Right.
the importance of addressing specific symptoms with targeted therapies,
Uh-huh.
and the unique considerations for managing concussions in young and para-athletes.
That's a lot to take in.
It is, but it's all crucial information for anyone involved in sports.
Absolutely.
And in the final part of this deep dive, we're going to take a peek into the future. We're going to explore the cutting-edge technologies that are revolutionizing concussion assessment and management.
It's going to be fascinating.
So stick with us. Welcome back to the deep dive. We're on the final leg of our journey exploring concussion in sport. And in this last part, we're going to step into the future and see how technology is transforming the way we diagnose and understand these injuries.
It's an exciting time to be in this field. There are so many incredible advancements happening.
Well, let's dive right in. What are some of the most promising technologies out there right now?
One area that's really taking off is virtual reality, or VR.
Oh, VR. I've heard about this.
Yeah.
How is it being used for concussion assessment?
Well, it's being used to enhance the vestibular ocular motor screening, or VOMS, that we talked about earlier.
Right. VOMS, that's the one where they track your eye movements.
Exactly. And traditionally, it's done by a clinician moving their finger back and forth in front of the athlete's face.
Yeah, kind of like a sobriety test almost.
Kind of, but with VR, you can create a much more immersive and standardized testing environment.
So instead of following a finger, they're immersed in a virtual world.
Exactly. They might be tracking moving objects in a 3D space, or navigating through a virtual environment.
That sounds a lot more engaging than just staring at a finger.
It is, and it actually improves the assessment in a few ways.
Oh, how so?
For one, it removes a lot of the variability that can happen with a manual VOMS.
You mean like if the clinician moves their finger too fast or too slow?
Exactly. In the virtual world, everything is precisely controlled. So the testing parameters are consistent across different assessments and different clinicians.
So it's more objective.
Exactly. VR also allows for more complex and challenging tasks, pushing the athlete's vestibular and ocular systems in ways that wouldn't be possible with traditional methods.
So it's like VOMS on steroids.
You could say that. And it's not just VR. Researchers are also exploring advanced brain imaging techniques that might be able to detect subtle changes that regular scans miss.
Now, this is where it gets really futuristic for me. Are we talking about mind-reading technology here?
Not quite mind reading, but we're getting closer to seeing the brain in more detail than ever before.
So what can these advanced scans show us that a regular MRI can't?
Well, techniques like quantitative susceptibility mapping and diffusion tensor imaging are showing a lot of promise.
Those are some big words.
They are, but basically these scans provide a more detailed picture of the brain's microstructure.
Microstructure.
Yeah, they can show us the tiny fibers that connect different parts of the brain and how those fibers are affected by injury.
Oh, wow. So it's like zooming in on the brain's wiring.
Exactly. And by looking at these microstructural changes, we might be able to detect concussions earlier and more accurately.
So it's like upgrading from a flip phone to a smartphone in terms of brain imaging.
I like that analogy. And it's not just imaging. Researchers are also investigating the potential of blood biomarkers to diagnose concussion.
Wait, blood biomarkers. So you're saying a simple blood test could one day diagnose a concussion?
That's the hope. Scientists are searching for specific molecules in the blood that are released or altered after a concussion.
So like a concussion fingerprint in the blood?
Exactly. If they can identify a reliable set of biomarkers, it could revolutionize how we diagnose concussions.
Especially in those crucial moments right after an injury.
Exactly. A blood test could provide quick and objective evidence, helping medical professionals make faster and more informed decisions about treatment.
It would be a game changer, for sure, especially for athletes who might be hesitant to report their symptoms.
Absolutely. It would take the guesswork out of the equation and allow for more personalized care.
Now, with all these incredible technological advancements, what are some of the big questions that concussion researchers are still trying to answer?
One of the biggest areas of focus is understanding the long-term effects of concussions, particularly the impact of repeated head injuries.
That's the one that keeps me up at night sometimes, thinking about the potential consequences down the road.
It's a valid concern, and there's still a lot we don't know about the long-term risks, especially when it comes to conditions like CTE.
CTE is a big one, and it seems like we're hearing more and more about it these days.
It's a complex condition, and it's difficult to study because a definitive diagnosis can only be made after death.
Right, so researchers are kind of working backwards, trying to understand the causes and risk factors.
Exactly. They're looking for ways to detect CTE in living individuals, but it's a challenging road.
And then there's the whole ethical dilemma of athletes returning to contact sports after a concussion.
Absolutely. It's a tough decision with no easy answers. We have to balance the athlete's desire to play with the potential risks to their long-term health.
It's a conversation that needs to happen between the athlete, their family, and the medical team.
For sure, open communication and shared decision-making are crucial.
Well, this deep dive has been eye-opening. I feel like I've learned so much about concussions and the incredible progress being made in this field.
It's been my pleasure to share this information with you. It's a topic I'm very passionate about.
And it's clear that this is an area where science, technology, and human compassion all intersect.
Absolutely. We need all hands on deck to protect the health and well-being of athletes at all levels.
I couldn't agree more. We need to keep the conversation going, raise awareness, and advocate for safer practices in sports.
Couldn't have said it better myself.
So to everyone listening out there, whether you're an athlete, a coach, a parent, or just a fan, we hope you've gained a deeper understanding of concussions and the importance of taking them seriously.
Remember, knowledge is power.
Absolutely. So stay informed, stay curious, and stay safe out there.
And thanks for joining us on The Deep Dive.